Yeah, we'll get back. So I was trying to tell you about Baryta, and we are trying to understand, or we have made an effort to understand this remedy in a different way, keeping the practical aspect in mind, because ultimately this theoretical knowledge tomorrow should be converted into practical utility. So keeping that in mind, I was just trying to give you a picture of Baryta as an infant, as a preschool going child, as a school going child, fine, with friends at home, with strangers, how exactly Baryta behaves. Now, before I take up the next slide, do you have any questions to ask? We'll just take 30 second or a minute's break here. And if you have any questions, please feel free. I'll try to take up the questions. Or if you are clear with the concept, then I'll go ahead. Okay. All fine. All clear.
So,
Yes.
so can we think of autism in this condition? Because
Okay. That's a very nice question. See now, probably the mental picture I'm trying to give you here might remind you of a condition called autism, okay, or ADHD, attention deficit hyperactive disorder. Okay. Now, Baryta could be a remedy, fine, because the way how we are looking at autism homeopathically is entirely different. Okay. So to cut short your question, or to keep it very short, Baryta can be one of the remedies for autism. Okay. But here, Baryta typically will not be an artistic disorder, artistic child. But what you have to understand is there is a little amount of slowness. See, autism is entirely different. Okay. Mental retardation is entirely different. We are talking of a normal child. A normal child in whom the intellect, the other faculties are slightly low. It is not as low or as bad as an autistic child, okay, or as bad as a mentally retarded child. In the past, I have given Baryta for MR, I have given Baryta for autism with no results, okay, because of a wrong understanding that every MR child is Baryta. Now, that's a wrong understanding, which I had. And as my students, you should not have that wrong understanding. And MR autism, the approach will be different. Here we are talking of a normal child who might have a little lesser mental faculty. Fine. I hope whoever asked this question, very nice question. I hope I am clear. Okay. See, they are normal kids, fine, but may not go to the extent of that mental slowness that they go into dyslexia or MR or autism. And autism, again, if you recall, will have a lot of hyperactivity. That aspect in Baryta is also missing. Baryta is not a very restless and hyperactive child. But but if the given case of autism fits into Baryta, then Baryta can be prescribed, no doubt. But what is it that I'm trying to clear here is all cases of Baryta, I mean all cases of autism or all cases of MR, please don't blindly prescribe Baryta, which I used to do way back, and I have had no improvement in such cases. Please don't repeat the same mistake that I have done. Okay. Now there is a question that is coming up. Many of you are asking Ethus and Baryta. Okay. See now Ethusa, we had a discussion. Again, a remedy which is for dull children, remedy which is for children who are what having examination fear, idiotic children, for fools parsley was the name of Ethusa. Now one thing I want to highlight here in Baryta, see in Baryta the intellect is not as bad as Ethusa. Okay, if you're comparing Ethusa and Baryta intellectually, Ethusa is more intellectually down. Fine. Okay. Baryta may not be as intellectually as low as Ethusa. Fine. And there's also another beautiful thing you need to appreciate in Baryta. Some faculty of Baryta will be very, very, very sharp. Okay. Some faculty of Baryta will be very, very, very sharp. If you look under your repertory, intellectual, Baryta is given 3 marks. Ethusa is not there. So what you also have to understand is some intellectual things, intellectual tasks, Barytas are very, very, very good. Okay. For example, my teacher whom I follow says many great surgeons, many great scientists are Barytas. Now, this is a huge transformation. This statement I am giving you is a huge transformation. We started with Baryta being very dull, very slow, dwarf, physically and emotionally. Now, what is the damaging statement I am giving you here is many, what is it, surgeons or many scientists can be Barytas. Now, I hope you understand the statement that I'm trying to make here, the point that I'm trying to make here. So, according to my sir, these surgeons, they are good at with only one skill. I hope you are getting this point. So, for example, you have a surgeon who is very, very good with appendicectomy. Now, tomorrow he gets a case of cholecystectomy, he might panic. Oh, cholecystectomy, I don't know. Fine. So, some super specialty where they can do only that particular task. Please take this statement with a pinch of salt. Tomorrow, don't prescribe Baryta for super specialist surgeons and all those things. This is not what I'm trying to tell you. But they are good at one task. One task. They're very, very, very good. So they can also be Barytas. Ethusas cannot be good even with that single task also. Ethusas cannot be great scientists. Ethusas cannot be great surgeons or great people. Fine. So we'll go ahead. I hope I have cleared the small doubts that you had come up with. See now, Baryta is a beautiful remedy. I have had beautiful results with Baryta. Probably if time permits, I'll try to share one or two cases so that you understand the practicality of Baryta. Okay, so we'll go ahead. See, one area that we homeopaths feel happy, feel proud is we have a lot of scope when it comes to kids, and kids also feel very, very comfortable with us. Okay, because we don't give vaccines, we don't inject them, we don't harm them, we don't do anything. So they know this uncle, many times they call us chocolate uncle, sweet uncle. Fine, because that's the comfort level they have with us. Now, how will Baryta be in clinic is the next component that I'm going to discuss, and let's make it practical. See, we have kids coming to clinics, and from the time they enter, one of our focus, one of our eye will definitely be on them. We'll be observing them. How are they? How are they entering? How are they sitting? How are they talking? Okay, all those things we try to observe. I can't talk of different remedies because we are running short of time, and I am given Baryta and I have to finish Baryta. We have phosphorus, we have lacasis, we have sulfur, we have cannabis, we have calcarea, we have a lot of cinna, chamomilla, a lot of child remedies. Now, when we have Baryta coming into our clinic, Baryta enters, with lot of timidity, with lot of fear. You might see Baryta hiding behind the mother. And when you ask who the patient is, then the mother might literally pull the child out. Oh, this is my son, this is my daughter. And with lot of reluctance, he might come out or he might be crying. Fine. Okay. And as a homeopath, you give them some time, you give the child to settle down. But unfortunately, Baryta child will not settle down so easily like your other kids. Mother will be telling he's a very good doctor, this uncle will not inject you, this uncle will give you chocolate, you give him chocolate also, no, nothing. He takes his own time to get comfortable with you. Okay, so that getting comfortable with you will take a lot of time in Baryta. Fine. So they are not inquisitive, they don't touch your BP apparatus, they don't touch your stethoscope, they don't harm you, they don't come sit on your lap. Fine. They don't pull your hair, they don't do anything of that sort. They're very safe. Your equipments in clinic also very safe. They are not like hayos who come touch this or remove this from that. Uncle, what is this stethoscope? And the stethoscope will be entangled. Nothing like that you see with Baryta. Fine. The comfortably behind the mother, or even if mother forcibly brings him away from the comfort zone, he might again keep his fingers, he might cover his face, talk very softly, go talk into mother's ears. All these things is what you see in a Baryta child. Okay, so very reserved, very frightful, very timid, never answers your question. There is no eye to eye contact, never looks into your eyes. These are all few observations we see in clinic when we have a Baryta child around. Okay, we'll move ahead. A lot of things to discuss. Now, Baryta adult or a Baryta boy. Now, the question for you: can a Baryta person fall in love? We are talking of adult. Naturally, one important component, important excitement for an adult will be having an opposite sex as a friend, fine, or falling in love, fine. Now, few of them say yes, few of them say no. That's good. Always keep that balance. Few say yes, few say no. I'm not asking you why no, why yes. Yeah, but yes, I got an answer here. Beautiful answer. Who's this? One second. Mega or Deepika, I don't know because yeah, probably Deepika. She says yes, sir, but takes time. You agree with this answer? Instead of just saying no and yes, she has gone a little deeper and she has given you an answer, and the answer is yes, sir, but he will take little time. This is what I wanted. Baryta might fall in love. I don't deny. If somebody falls in love at 14, 15, 16, or that's the age group when the entire gang of your friends are in love, they have girlfriends, one guy will be left away. See, not necessary that one guy should always be Baryta. That one guy who is left away or he has not fallen in love, he might have his own reasons. But assuming he is Baryta, he will take little time to understand what is happening. Oh, this is love. Fine, my friends are falling in love. Okay, probably this is the age even I should look out for a girl. Fine, this to understand, this to comprehend an idea getting into his head and that idea getting materialized might take some time. Okay, so I've taken this from some foreign author. If I'm right, it should be Philip Bailey or Vithalka's book. I'm not very sure, but either of the books I was going through, and they say they enter a romantic relationship, but they take little time. Fine. Now, why do they take time? Is again something that you need to understand. This text has already come up. I wanted to ask you, why do you think Baryta man, Baryta boy takes little time? Why do they take time to fall in love? Can I have some quick inputs? You're all there. It's a very interesting part of Baryta. Okay, good, very good. Somebody says it could be out of fear, it could be out of shyness. It could be a fear that others might judge them. Beautiful, good. A fear of being rejected. Yes, yes, good. I might look dwarf, I might look short, or I might look normal physically, but then I have that inhibitions. What will somebody think about me? They might laugh about me, they might reject me, or that shyness, which is my basic disposition, might prevent me from approaching a girl. Okay, so they're likely slow in developing an attraction towards opposite sex. Fine, we'll go ahead. Yeah, probably out of being rejected, probably out of fear. Okay, now Baryta adult. Yeah, we're talking of Baryta adult in clinic or Baryta generally. Generally Baryta adult. Now Barytas, from what we understand, what we look at is they are the children. I mean, they are the adults. Naturally, they grow up. They grow up being timid. They grow up being shy. Fine. There will be a lot of introvertedness. Good, agreed. There will be a lot of confusion. Okay. I had recently treated a case, a very nice case of pilonidal sinus. Pilonidal sinus. This, you are a surgery student, third year student. You can go back and you can read. I'll not go into the details of the condition. Mother had got this particular child. Child means is 10th standard. It's a beautiful case. Surgeon told, we need to do IND and we'll have to do a small surgical procedure. But this guy, when he came to us, again, say 10th standard, 16 years old guy, the first entry itself, there was so much of shyness. And when one of our assistant doctors took the case, and when he came, his mannerism, his behavior, his understanding, all those things were pointing out towards what I was just trying to explain. That shyness, that timidity, fine, the difficulty in understanding. When my assistant doctor was questioning him, he had a lot of difficulty in understanding what is he questioning, how do I answer. Many times, remember, Barytas, when a question is asked to them, they keep looking at the mother, or they keep looking at whoever they are accompanying with. Mother or a Baryta wife might look at the husband. See, this is not out of fear. They give a helpless expression looking at the mother. Mother, please tell me, what is this man asking? And how do I answer this particular question? Okay, so there will be a lot of problems in understanding. There will be a lot of helplessness. Fine, there is a lot of insecurity, lot of confusion. Okay, now this man, this boy who had come to me, he was given Baryta self. Baryta, it was a hot, thermally was hot. Baryta carb is chilly, so he was given Baryta self. And a month after that, huge transformation happened. The mother has agreed to give a video. I need to record it, and probably with her permission, I can show you the video where her son has transformed so beautifully. Pylonidal so went, it dried. She said after he started with your treatment, sir, he has developed interest in studies. He has developed interest in taking care of himself. Morning is getting up, he's jogging, and he has lost good amount of weight. He's not eating the food the way he used to eat before. A single dose of a remedy, a right remedy can do magic, can do wonders. So pylonodal sinus disappeared, and a lot of other things, lot of other good things started happening. Okay, again they are the people who keep laughing without cause. And one specialty of Baryta, remember, in your gang, if you have a Baryta, or tomorrow if you see a Baryta, something serious is happening, some serious discussion is happening, and Baryta starts laughing. You know, this is what you need to understand. Barytas don't understand the seriousness of the discussion that is happening. They're very immature. They don't have that judgment capacity. What is serious? When I should laugh, when I should not laugh. That seriousness is not there in Baryta. So people who laugh without any reason or who laugh when something serious is happening. And when you come across people who don't have confidence, and Beretta, from the timidity, from the fear, from their basic trait, you know that they are the people who don't have confidence. Confidence want of, and there is a lot of inferiority complex in Beretta. Right? They feel very small. They feel very inferior. So inferiority complex, right? Want of confidence, and that fear of others' opinion. And this in the next level goes to the delusion level where they feel they might be laughed at, where a Barata feels that they might be criticized. So delusion criticized, you will be delusion laughed at. In all that you have Barata. So confidence want of, and people who answer wrongly. See this statement, you please understand. Now, what do you understand by this? People who answer wrongly, meaning you ask them a question and the answer will not be appropriate to the question that you have asked. Now, why do you think this scenario or this situation is happening in Baryta? You ask them a question. Yes, very good. Yeah, I am happy. None of you are Barytas, at least looking at the speed that you are answering. There is no slowness. You're all fast. Good. So they don't understand what is asked, or even if they understand it in a wrong way and they give you a wrong answer. So tomorrow, if you come across people who answer wrongly and people are confused while answering, okay, while answering, they're confused. There is no clarity when they're answering. They're answering in a very confused state. You can think of Baryta. And people who do not understand the importance of things, meaning people who give wrong priorities. People who give wrong priorities. For example, see these points I have taken from a book, Introvert Frequent Encounters by Dr. Praful Vijayakar sir. From that book I have taken these points. So people who do not understand or people who do give wrong priority. For example, we have a case of a serious pancreatitis. Okay, we had a man recently with pancreatitis, but this man is worried more about the eczema on the skin. Doctor, these pains, this vomiting, they are okay, but please do something for the eczema. See here, again, another remedy will come to your mind. That remedy is palladium. It is not there in a syllabus, but you should know palladium is again a beauty conscious remedy. See, for example, in palladium, if it was on the face or if it was any other part that is visible and if it looks bad, then you could have thought of palladium in this case. But the eczema is over the leg, which you know can be covered. Now, why I'm trying to give you this example is pancreatitis more important or is that skin eruptions on or eczema on the leg, which is more important as a third year student? Which one do you feel is more important? Yes, pancreatitis is more serious. It is life threatening. But what is the priority a Baryta person is giving? He does not understand the importance of which one to prioritize, giving the wrong priorities. So when you come across such patients tomorrow in your clinic, please think of Baryta. So people who do not understand are giving wrong priorities, and from your experience, you know that you have to ask the same question in different ways. Fine, you have a patient in front of you, he's not understanding your normal questioning. So you change the same question and you ask in a different way. Fine. So you can think of Baryta in such cases, or you can think of Baryta in those patients whom you have to ask, you may have to change the question, or the same question you ask 2 to 3 times. You make them understand the question. Probably it's a Baryta. And Baryta is basically a very routinistic person. I told you a surgeon. Yes, he is good at his work, but it should be the same surgery. Any new surgery, he will not be very comfortable doing. So, routinist, okay? And people who do not change job for years. Probably this again could be an entry point for you. He is working in the same company for last 20 years. Mind you, homeopathy is not so easy. Any person who is working from last 20 years, please don't blindly give Baryta. In this situation, the physician is Baryta, not the patient, because the physician has not understood the essence of Baryta. A person working in the same job for quite some time, though he has got better opportunities or though he has got something else, he would not change. He stuck to the same job. Now, why Baryta in this situation? They're routinistic, they're used to kind of a job, and they are not ready for new challenges. They're comfortable. Fine. When somebody gives you this answer that I'm comfortable and I may not be competent for a new job, fine. There probably you can think of Baryta. Okay. Now, a last slide to complete the adult Baryta. Anything new coming up? Now, there's a question, any other remedies for routinistic people? You can think of calcarea. You can also think of calicap. Probably a third year syllabus, you can think of calicap. Somebody will be doing. Calis, again, are very routinistic. Calcareas can also be routinistic. Baryta is 100% routinistic. Okay. So, any of these new gadgets, Barytas may not be very comfortable. Okay. For example, smartphone, 3G, 4G, 5G, fine. They don't upgrade themselves technically. You can think of Barytas. Fine. So people who don't upgrade themselves technically can be Barytas. Okay. People who can't use new gadgets can be Barytas. Can be. And they're very indecisive. Now she wants to buy fish. So she's checking, should I buy this fish, that fish, or something like that, very indecisive. They cannot decide, irresolute. Now, the last component of today's class, when Baryta becomes old, we started with infant, then we are going ahead to the last part is old age. Now, many of us tell old age is second inning of childhood. You would have had your own grandfathers, grandmothers at home, and few of them you'll be seeing that they become very childish, they become very immature. Okay, probably second childhood, yes, second childhood, probably second childhood. So during old age, Barytas will have a lot of problems. They will have confusion, they will have memory issues, fine, and slowly they might go into dementia, Alzheimer's, and all those things. So laughing again for serious things, all those things you might have in Baryta old age. They might have difficulty in understanding. See again, when we talk of irresolute for trifles. There is a beautiful rubric in your book, irresolute for trifles. Now, what is this? Trifles means small things, simple things. Again, Philip Bailey, I had taken this from Philip Bailey. So, in the author says, Baryta, see, all worldly things, they are too complicated for Baryta to understand. So if he goes to a supermarket, if he has got two jams or two ketchups or two soups, he'll be confused. Should I pick this Kisan jam or should I go for some other jam? Should I pick this or should I pick that? So confusions in Baryta will be for small things. Confusions in Baryta will not be for big things. Pandemic, oh, what will happen? This, that. He is not worried about that because Baryta knows it is not within his reach. Fine. So confusion for small things, you can think of Baryta. Okay, Baryta, old man. Fine. Now, if you have any questions to ask, I don't know how many more minutes we have. Yeah, probably some time we have. So if you have any questions to ask, I'll be happy. Or in a nutshell, what I want you to understand here is Barytas are basically very slow, very immature, fine. They have problems understanding new concepts, new things. They are routinistic people, children who have learning difficulties, children who can't concentrate, absent mindedness in children, okay, absent mindedness even in old people, memory issues, okay, confidence want of, lot of fears, delusion, they will be criticized, delusion, they will be laughed at, which comes because of that inferiority complex in Barataka. Okay. So if you have any questions specifically, or if you want anything that you want me to repeat, I'll be very happy to take up the questions. You have any questions? No questions? Clear? Okay. So if you are clear with Baryta mind, next class, we are already we have exceeded the time. Next class we'll talk of Baryta particulars. Okay. So thank you for joining in. And how will they come to clinic in old age? Fine. See, old age, they might come to you with a lot of glandular problems. I'll be trying to tell you in the next class. And same thing, when you question, they might have difficulty in understanding questions. Fine. Or they might be laughing simply, or when something serious is happening, when you're trying to explain them about seriousness, they might have they might take it very light because they don't understand the gravity of the problem that you're discussing with them. And one thing I forgot here, Barytas get fooled very easily. They can trust people very easily. So there is something in your repertoire called as credulous. They trust and they get fooled very easily. So that's one more thing I forgot to mention. 470 rubrics you have in your mind chapter, and it is humanly impossible to give you all that in 1 hour. So I made a small effort to give you the core, and you can definitely refer books and you can build on the information that I've given. Okay. So thank you for joining in, and next week we will start with particulars of Baryta. Thank you.